Sabrina Pennington said she'll be a little late, but I think we'll go on and get started. The first item is approval of the minutes, which you've all received. Are there any additions or corrections to the minutes?
Move for approval.
Second?
I'll second.
All in favor?
Aye.
Opposed? Minutes are approved. We have a couple of housekeeping items that I think we'll take up at the moment. One is that we have officially received the resignation of Dr. Wright, which I reluctantly accepted, but under the current rules and regulations, because of his change in residence, he could no longer serve. And certainly like to thank him for what he added to the board and his time that he contributed to us and to the health department. But then it'll be up at the commissioners and as to how. I guess we have to put someone in his place, and we'll try to come up with some names.
Right.
Under the change in regulations, I'm not sure whose appointment it is.
I'm just talking.
We're not either. We're just talking about.
We think we know, we better check.
Yeah. And the other thing is that we need to reappoint officers for this year, and which means president and our chair and vice chair. Is anyone interested?
You do an excellent job.
Make a motion.
We do both together, or?
I think you can. I've not talked to Sabrina, but she's not expressed a desire to be off, so. If there's a motion to continue on officers and.
Does it require a motion? Does it require a motion?
Yeah, you have to vote.
Okay.
I move that you continue on as chair and Sabrina as vice chair.
For a second?
I'll second.
All in favor?
Aye.
Opposed? Okay. So, I guess we'll move on to Deputy Director of Clinical Services report. Or Dan, are you doing the health officer report?
Dr. Bell's didn't give me anything to pass on, so we'll
Okay.
move straight into Beth's report.
Just some quick updates. We are looking to move our mobile unit. I mentioned it last time in Cambridge City. We partnered with Cambridge City Christian Church to be able to offer it in connection with their food pantry. And that's the third Saturday of each month. And then they also do it the Wednesday following. So we're trying to determine exactly if we'll be there both times or just on the Saturdays. But we thought that would assist in being able to provide the services that we intend to provide that we're not seeing right now when we're at the Goal A. Just an overview of January. We did provide 33 TB tests. We are currently treating 4 LTBI, 1 active TB, and then we also provide services to 2 Class B TB. So that would be someone coming into the States that something came up in their medical review before they left that could potentially be TB. So we have to see them again, run them through TB test, X-ray to confirm that that's not active. We've also started testing lead in-house to help with our lead cases for the kiddos that have tested high. So we did test 9 in January, and then we provided vaccines for 41 children and 103 adults in January. And then with POSHA being on board, we've ramped up our STI testing again, providing 44 HIV, 45 Hep C, and 46 tests for syphilis, chlamydia, and gonorrhea. Of those, we did have 10 that we treated.
So what were the cases you had to treat? What were they?
Most of them, I think, were chlamydia, gonorrhea, and then a couple off. we think we had herpes and
We had a herpes.
The BB.
A couple trick,
No syphilis, so.
no syphilis.
And they did say on the Indiana Department of Health update this morning that there was a decrease in syphilis cases for adults. So it seems like we're moving in the right direction. And then our needle exchange program, during January, we saw 152 participants, took in and gave out 12,400-ish needles and 166 naloxone. The other item I wanted to touch on was our case management. So case management is typically what our public health nurse would do. So this is when we have communicable diseases in the county, we have to maintain communication with those patients, follow up to make sure they're treated, do contact tracing if necessary. And then this also includes like the kiddos with high lead. So right now, or as of the end of January, we had 129 cases that we were overseeing. Of those, the biggest piece is 63 lead cases, 17 with LTBI, and 29 Hep C. And then others are pretty much one-off cases of random. There's 8 Hep B, but that's mostly one-off after that. In January, we also, or to current date, sorry, we've had 5 deaths that did list the flu, influenza A, as a potential on the death certificate, and 1 that listed it as a primary. So those have been reported to the state so they can continue following up on those cases.
Okay, so how many leads did you say?
63.
Okay, that's 63 individual cases. I assume that's because they really reduced the amount of lead that they'll tolerate, to almost zero.
Correct. So
that's
3
caused a
years
big
ago,
jump.
before these numbers were reduced, we wouldn't have seen this many. But because they did lower the levels down to HUD standards, the cases will increase.
So what are you finding in the environment? What are you finding as the cause? Is it still older housing or?
It's mostly the older housing and the paint, the lead-based paints and the porches. A lot of times the exterior, then it gets dragged inside from the exterior. A lot of the interior of the homes have already been remodeled and been encapsulated with latex paint or whatever. It's typically coming from the exterior of the home.
That's all I have.
Any questions? Comments? Okay. On to Director of Environmental.
We spoke last time, a couple of houses, house on Green Mountain Pike and then the one on Main Street in Williamsburg. Both septics are still in failure. Then we added a housing complaint for a house on Washington Road South. The house is deemed unfit. 2 women still living there. They haven't had any sort of power or anything since 2011. So they have an unfit placard placed, and then we have a next visit out with them March 10th. But we did bring 2 of our food inspectors with us today. This is Jason Howard and Craig Markley. Kind of want to recognize them and spotlight them. They are the first 2 in the state of Indiana to be standardized with the new food code for inspections. If one of you guys don't mind standing up and kind of giving us a detail of what you guys went through.
Through the standardization, Sharon Petit with the State Department of Health, she went through the standardization with the FDA. And then what we do is we go with Sharon, and she basically goes through us the same as she did with the FDA. Go to different establishments depending on what type of menu they have. It could be a highly susceptible population. It could be a place that does a complex menu, and she makes sure she sees that we're seeing the same thing that she sees. So basically, when she was trained at the FDA, more or less we're being trained through FDA as well. And Jason and I went through that. A little bit of anxiety in the beginning for but once we got through it, first couple inspections, and we knew over the years that we've spent as inspectors, we've been doing what we've needed to do. So I think it's a good feather in the cap for us to be the first two in the state to do it, and yeah, I think we're proud to volunteer to be the first ones in the state.
Well done.
So,
Thank you.
Yeah. And with that said, now that you're standardized, you can standardize the other inspectors in our office, correct?
that will possibly come. Yeah, that was with the new food code. If the new food code is passed by the governor, then we should be able to standardize others.
And that's what leads me to the next statement here is why they were standardized, why that is a thing now. It's because the State Department of Health is switching to FDA food code.
Right.
Very similar.
Finally coming up to the FDA food code, yeah.
All right, congratulations, guys. Appreciate it.
Thank you.
Any questions for him?
Well done. Yeah, thank you.
And that's all I have for the environmental stuff.
All right. The first thing I want to discuss is I propose to county council to give an increase to the board as far as their pay goes. And the reason for that is I think I asked a lot of the board, and with new HFI funding coming up, we're going to have a lot of meetings. We're forming an HFI committee right now, and the pay has not been increased in many years. It's not large, but a standard board member as of now gets paid $225 quarterly, and it was approved to bump that up to $325 quarterly. And for the sitting president or chairperson, it was $262 a quarter, and that's going to be bumped up to $400 a quarter from this point forward. And that is going to be funded from the capital expense line out of Health First Indiana. So we had budgeted $37,000 for a new health department vehicle, and we was able to purchase that vehicle well under budget. So the leftover funds is going to be what funds this pay increase. And with that said, we're about to go over a lot of contracts. This is why we thank you just a tad bit more. So we had a meeting today with the State Department of Health, and a little bit touched on Health First Indiana and the 26 budgets. Obviously, we don't have a dollar amount yet until that gets to legislation. But our budgets for 2026 are going to be due to the state on June 1st. So we're going to have a small window from the time that we know how much funding we're going to have to what we're going to do with it and how we're going to budget that. And then the 24 expense reports from Health First Indiana are going to be also due on June 1st of 2025. Partnerships, all partnerships as of now are going well. As discussed last meeting, we wanted to go over Centerstone's MOU or contract for the Stride Center. The board, I believe, has had a chance to review that. Chris, our attorney here, he's had ample opportunity to review it, and we're ready to move on to a vote. Are there any questions on MOU before we move on to a vote for myself or Chris on the legal aspects?
I think we all reviewed it last month and set out in our packets. Are there any questions, concerns?
This is posted on our website, per state. I don't know if it's statute, but per the HFI rules, it is posted on our website. And for the viewing audience, this is geared towards the Centerstone's Stride Center. So I think we're ready for a vote if the board's ready.
I'll make a motion.
Is there a second?
Second.
All in favor? Aye. Opposed? Thank you.
All right, so the next one is the Reed Hospital extension of services or add-on to the contract that was already in place. The board's had time to review that, and Chris has had time to review that as well. There were some minor tweaks in it, not much. As far as the titling going, it was retitled to grant add-on agreement instead of just grant agreement, because this is an add-on to the original grant or agreement. Other than that, the dollar amounts and the deliverables of that grant have not changed. And that is also posted on our website.
Again, we had a chance to review that last time. You had it in the mail. Are there any further questions or comments? Is there a motion to approve?
I'll make a motion.
Second?
Second.
Further discussion? All in favor? Aye. Opposed? Okay, motion carries.
And we're still working on an MOU with Union County when it comes to lead risk assessments through their HFI money. As mentioned earlier, we are working on the Health First Indiana Advisory Board / committee. I believe I have about 11 community members that have agreed to sit on that board. As of now, I've invited the commissioners, I've invited a representative from county council, and then obviously anybody from the health board to sit on that board. As of now, I believe what's going to work out the best is to have the meetings on the last Thursday of the month. And then as we move closer to that June deadline, or maybe even May, we may have to bump that up to every couple of weeks. We'll have to fill that out in the first meeting. I'll be sending out a calendar invite to the proposed people that's going to sit on the committee, and then I'll send one out to the health board. If anyone from the health board wants to permanently sit on it, or if you just want to kind of come in and go. I'm assuming, Dr. Ryder, you're going to be on that committee as the chair. Any questions on the Health First Indiana committee? Financial report. All 25 budgets have been submitted to the auditor's office and been approved. We're still waiting on the auditor's office to balance their books, as they call it, so we can get our carryover. So if we discussed last meeting, Health First Indiana, part of the Reed's contract was based on that carryover request from Health First Indiana, which was approved by the state. We've just not seen it at the local level yet, so I'm waiting for it to come out of the 24's budget and actually deposit into the 25 budget, with a couple other budgets as well, but we're on track. Henry Schein, as discussed in a couple meetings prior to this, we had some equipment purchased that shouldn't have been purchased, that was quite expensive. Through the help of Chris over here and some contact with Henry Schein, they agreed to reimburse us about $62,000, and we're going to ship the machines back to them. So I think we've resolved that issue, and I have limited my purchasing of Henry Schein to 0 at this point until this is finalized. So it helps push them a little bit further into that. So I called Friday, this previous Friday, to Henry Schein, and she did relay to me that it was approved by her superiors for a refund. The check will be cut this coming Friday and physically mailed to us, so we should expect that in a couple of weeks. And then once I receive it, I'll ship it back to them. Good job. It wasn't me, that was all Chris over here. Credentialing process. That is a whole different ballgame. We're still working on that. And I'm getting a lot of help from the treasurer, the auditor, Reed Hospital. I think I've reached out to Mark once or twice. It's a beast, but we're getting there.
I think it's done by design.
I think so. Just to confuse you.
Yes. Very time consuming.
No reciprocity, no
Yeah.
easy way to do things. It doesn't make any sense.
So we did apply for the FET grant, the Public Health Emergency Preparedness Grant that we discussed last time with the board's approval. Sent out that email to everyone, nobody opposed. And I went before council and they approved us to move forward with it as well. So right now, we've only signed a letter of intent. We've not actually agreed with anything other than that we agreed to apply for it. So we did, we had a few applicants for the public health nursing position. We held interviews. We had 3 applicants, only one interviewed, the other 2 dropped out. She had a good background and was qualified for the position, so we had HR reach out and do a conditional offer. And there were some hiccups in that, and HR and I had a discussion, and we both felt it was appropriate to rescind that conditional offer. So we're back down to the drawing board. So I have it reposted with Kicks 96. I'll probably be reaching out to Western Wayne again. HR has reposted it, and we've got it on all the social media and websites. For the viewing audience, that's waynecountyhealth.in.gov. So as we move forward and POSHA's advancing over here, we're looking at other things that we can offer to the community where there's some lacking maybe or not enough places to get certain services done. And 2 of those right now is DOT physicals, Department of Transportation physicals, and sports physicals. So the sports physicals is really not much of a community need, but if we're offering one, we might as well offer the other. But the DOT physicals is needed. There's not too many places these drivers get their buy-in every 2 years physicals done. So I'm asking the board permission to provide these services there at the health department.
And there's you proposed a fee also, wasn't it? $400 for the,
Correct.
And was it $25 for sports physical?
$125 for DOT physicals and $25 for sports. That is consistent with the surrounding areas, other clinics pricing. We're not underpriced, we're not overpriced.
So $125 for the,
correct, DOT physicals.
$25 for the sports physical.
Correct.
And do you have the staffing to support that?
We do. So POSHA is certified to do DOT physicals, and you only have to be a provider to do sports physicals according to the High School Athletic Association.
And that association now will allow MPs and PAs to do the sports physical.
So I don't think this is going to be an overwhelming. I don't think we're going to have 5 people in the door every day for DOT physicals. Most children probably get their sports physicals during their annual wellness or something of that nature, but the DOT physicals was the major thing.
Sure.
I think it will be a good service to the community. So we need a motion to approve.
I'll second it.
Discussion? All in favor? Aye. Opposed?
And with that said too, because we are adding those services and we are charging fees, I have to amend the fee ordinance with the permission of the commissioners, obviously. But I will be, I believe I'm on the agenda tomorrow to go before them and for one of many things, but one of them would be the full fee ordinance to adjust that accordingly for those 2 charges. And Chris has reviewed the fee ordinance as well and had me add some language to that. It should be ready to present.
So the fee ordinance was $125 for the chauffeurs
$125 for the DOT physicals
and $25 for sports. So is there a motion to approve?
Just did it.
Well, I don't know if we roll it into one. We approved the offering then.
Oh,
Motion to approve.
Second.
Second. All in favor?
Aye.
Aye. Opposed? Okay.
We also met with our 2 local 340B pharmacies, Medicenter and Phillips. So we got some clarification between both of those pharmacies, so we're working well with them. We still use some of the online ones if the patient requests those particular pharmacies. Moving into that is now the 340B consultant contract that we discussed a couple times. It has been reviewed by council and approved. Chris worked with Josh Free, I believe is his name.
Correct.
Yeah, he's the one that drafted the agreement, and he will be technically our consultant for this on the 340B program. And I believe I sent this out to the board as well for your review. Are there any questions on the consulting form? So again, this company will come in and initially conduct an audit of the 340B program, and this should tell us where we're excelling or not excelling, and then we can adjust accordingly to this audit. And then he also will supply 5 hours a month of consultation. Anything beyond that would be an additional charge.
I know that it's automatically renewable.
So Chris changed that language, so it is, we can cancel at any time for no reason basically. So
No, I saw that, but if we don't cancel, it's automatically renewed
automatically, yeah, for 3 years.
for 3 years, up to 3 years.
And that's approximately $42,000 a year is what it equates to.
But it's something we can review if we have concerns. And I think
Yeah,
the whole
absolutely.
thing is that we have to be making money on the 340B program to justify it.
Yeah, so the language added into that, to the communication between Chris and the company is, should we become ineligible to participate in the program, or should the client choose to permanently terminate its participation in that program, we should have the right to terminate this agreement without written notice. So we would be responsible paying that consultant up to that time for the services provided, but nothing afterwards.
Other questions, comments? Entertain a motion to approve.
So moved.
A second?
Second.
All in favor?
Aye.
Opposed? Motion carries.
And we'll move into the last part of the miscellaneous here. We are in the middle of another billboard campaign. I tried to retrieve the website numbers for you to see, if we increased. We did increase from December to January, and from a quick glance at it, we did increase from January, the month of January to present time. But the state didn't respond to my quick requests, so they're the only ones that can physically pull that data for me to print. I can view it on my computer, I just have no capability of printing it. I guess I could have screenshot it, but so I would have to assume that we increased a little bit, if not stayed the same. Again, we still doing the radio ads, and I have asked Kicks 96 to transition that radio ad into an employment ad for us for the public health nurse until that position's filled, and then we'll go back to our normal ad. Did order new laptops for the staff. We ordered those per IT's requirements, their specifications for those particular laptops. They're in, and IT is setting those up for us now. Our current laptops are dying one by one, so these laptops should last us for quite a long time. And then we'll order 2 tablets computer tablets for the clinic side of operations. So as patients come in, multiple people can check in at one time by using those tablets, so we can speed up the process and appointment times and things. Are there any questions?
Is everything done as far as working with funding Centerstone on emergency responder?
So that's what we approved today, was the Centerstone MOU.
Okay, that was that MOU.
Correct.
How about did we approve the MOU on immunization?
We have not, we're still working, I'm waiting on a response from Centerstone with our modifications on that. There, in my opinion, there's no reason even to have an MOU for that, because we're not gonna turn away anyone anyways. If they're coming in for a preventable vaccine that we can cover under our 317 program, we're can cover it if we have it. That's, but if they absolutely want one, I mean, we'll send it to Chris.
That's the one to review, so that's next month.
If they respond to me, yes. If Centerstone responds.
Oh.
Yes. Any other questions? That's all I have.
Moving forward, any suggestions you have for possible new board members to Dan, so we can forward it to the commissioners?
Are there specifications related to education for that position?
Uh,
As previous was a,
They have to be on that list. There is a list.
Mhm.
We have 2 public members, and that's our max. So everybody else has to come from the professional list.
okay.
And
For a replacement of Dr. Wright, I was mentioning the superintendent role.
there is something about political party affiliation and the maximum number, and we're at the maximum number of Republicans. So my understanding, it has to be a Democrat or an independent.
Dr. Wright did say he would send me some suggestions, but I haven't received those yet.
I think it would be good if we had somebody from the education
That's
world,
what-
because that's,
that's
you
what I say.
Well, hell, because I retired.
know, I mean, that's where he was on the list for all that
Okay.
profession.
Maybe we need to revisit that list.
I can send out an email to all the superintendents
Okay.
in Wayne County and ask them if anyone's interested and kind of give them the criteria if you want me to do so.
I think Sabrina has compliments she'd like to make.
Yeah, I went to the expo on Saturday, and you all had a table and a representative, and your representative, he was absolutely outstanding.
Thank you.
Got a lot of discussion around how cool and nice he was, and professional. It's just really, I was really proud to be a part of this board with staff like that.
Gennaro Sparks is his name, and he is amazing.
That's it.
Yeah.
He is amazing. So I just want to say that. You don't get to hear that often.
Any other business? I think our next meeting will be the second Tuesday in March.
Yeah, I think it's the 11th.
11th. I think you're right. And are we going to have a committee meeting after this, or are we postponing that until March?
I have it on the schedule if you want to.
I think there's a few things that we ought to discuss briefly.
That's fine.
So those people who are on the subcommittee for the syringe exchange program and hepatitis C treatments, stay active for a brief meeting. Is there a motion to adjourn?
So moved.
For the second?
Second.
Yes. All in favor?
Aye.
Thank you.